Hello, how are you?
Good, how are you?
I'm good. My name is Madison Giddens. I'm a student physical therapist from the University of St. Augustine. Could you go ahead and confirm your name and date of birth for me?
Kaylee Pridgeon, 7/11/2000.
All right. So today we're going to be taking a couple vitals for you. We're going to be doing your blood pressure and heart rate just to make sure you're living a healthy lifestyle. And if not, we can definitely do something about that. Is that something you'd be okay with?
Yep.
All right. Is there anything that we need to be worried about health-wise that would prevent us from being able to take these measurements today?
Nope.
No? Okay. So for your heart rate and blood pressure, there are three places, that we can take these measurements. So there's your carotid artery, which is going to be on your neck right here, your brachial artery, which is going to be right under your biceps, and then your radial pulse, which is going to be right here on your wrist. So personally, I think that for your heart rate, the best place to take it is going to be on your wrist. That's how I get the most accurate measurement. And then for your blood pressure, it would be most accurate to take it on your brachial artery. Is that okay?
Mm-hmm.
All right, sounds good. So before we get started, I'm going to go ahead and find your brachial pulse. So if you could lay your arm that way, okay? And I'm just going to find your pulse really fast. So if you could try to push my arm. There you go. Just a second. All right, so it's right here. And I'm going to go ahead and put the blood pressure cuff on you. Is that okay?
Mm-hmm.
All right. Take this off really fast. If I can get it off. Push it. Technical difficulties. Do you mind holding this for me? All right. Thank you so much. All right. Is that comfortable for you? It's not too tight? Okay. So before we get started, I'm going to test this for you, make sure it's working okay. I'm going to find the occlusion rate. Okay. So let me find your pulse on your arm really fast. Okay. So her occlusion rate is 120. I'm gonna let that deflate really fast. Okay. So before I take your blood pressure, we do have to let your arm rest for a minute just so that we can get some accurate measurements, because when we do squeeze the arm, it gets a little off. So while we're waiting on that, actually I'm gonna leave this on just a second, sorry. I'm gonna take your heart rate and we're gonna do that 2 times just to make sure it's accurate, okay? So I'm going to use this as a timer.
Mm-hmm.
Okay. All right, let me find your pulse one more time. Okay, we're going to start measurements. All right, so your heart rate is 66 beats per minute, which is great because the norm value for people your age is 60 to 100 beats per minute, so that's great. So just to confirm that, we're gonna take it one more time, but this time I'm gonna ask if you could put your hand on your stomach, just because we like to record things a little differently. And I'm gonna find your pulse one more time. All right, ready? All right. So your respiratory rate is 14 breaths per minute, which is great because the normal value for people your age is 12 to 18 breaths per minute. So that's great. That's really healthy. And so now that we have waited a minute for your arm to relax, we're gonna go ahead and take your blood pressure. And I brought these disinfectant wipes, so I'm gonna go ahead and disinfect the earpieces on my stethoscope to make sure it's clean for you. Okay. Now that those are disinfected, I'm gonna put these on. Okay. Is it okay if I plus this right here? Mm-hmm. Okay. And this still feels comfortable, right? All right. Okay. All right, you ready? Okay. Okay, that was great because your blood pressure is 118/74. The normal value is 120/80, and that's very close to that. So you're doing great. I'm done.